Let's go to this conversation now. The health department has confirmed the 6th cholera case in the country. The patient is in Gauteng and is residing at an informal settlement, and we'll get more details on that patient in just a moment. But remember, it may take between 12 hours and 5 days for a person to show symptoms after eating contaminated food or water. And cholera also affects both children and adults. And of course, in light of some misinformation that we've seen in the public domain, we'll now speak to the Health Minister, Dr. Joe Phaahla, just to get a sense of how they're also contending with this as well. Minister, thank you so much for your time this evening. We do appreciate it. Let's start with the patient. What do we know about them?
Well, what we know is that this is a female patient, a 19-year-old, who's residing in the area in the Ekurhuleni district, metro, in the area of Benoni. And the patient was traced through the outbreak response team, which is, checking on contacts of the other 5 people who have reported. And this particular patient is a close contact of in fact, the patient who passed away from the same area, the only patient thus far who passed away, who also came from Ekurhuleni. So at this stage, what we know is that the spread of the disease, it's still confined to people who have been in close contact with each other. So that's what we can say at this stage.
Did she have any travel history?
No, this particular, as we have indicated, the only ones who had a travel history were the first 2 patients who had traveled to Malawi and back. And then the 3rd patient was a contact of those 2 who had not traveled. The last 2, case number 4 and 5, had also not traveled. So this is the 4th patient who has no travel history. In fact, what we can say is that the last 3, the main concern is that even there was no direct linkage to anybody who had traveled in terms of the last 3, including this particular patient. So sometimes, of course, it might be difficult to trace the connection, because it's not only, those first 2, it could be linked, but in terms of who they might, the last 3 could have had contact with, whether it might be people who have traveled. That's why we said last time that this particular time, including this present case, we have to, interpret it now as a domestic case, not as a travel-related case.
And I'm going to get to that in just a moment. But at the moment, so all these patients are in Gauteng. Are you concerned about other provinces as well?
Well, we are concerned, not alarmed, in the sense that if you look at, for instance, we've mentioned previously that the outbreak is still very strong in Malawi, and then also in Mozambique, so our northern and eastern bordering countries. The travel is also between those 2 countries and South Africa is quite very strong. So the possibility that some cases may emerge in those, especially in the northern provinces and the eastern provinces, is still very high. So from that point of view, we remained on the alert in terms of especially the northern eastern side of the country. But at this stage, in terms of surveillance, we have not clinical or laboratory, confirmed cases, except in Gauteng.
And of course, talking about, these travels, but then also looking at the fact that some people locally are displaying symptoms or also have cholera and all of that. So has there been an establishment of the source of the transmission in the country?
At this stage, all indications are that the I mean, as I said, we could trace the link with the first three. From number 4 up to the current case, all that which is presenting, it's a kind of a person-to-person close contact in terms of people who probably have shared. We don't know case number 4. Where would they have? It wasn't very clear. Case number 4 in terms of where they would have contacted, but within the 6 thus far, even though there is no clear linkage between number 4 and 5, even in terms of the areas, the last 3 were in Diepsloot, the others are in the east, in the Ekurhuleni area. So there is no clear linkage, but it's still at least limited to people who are the first 3 and then the next 3, especially 2 of the last 3, in close proximity to each other. So that's still the comforting issue, that we don't have an indication of where a water source, where people share an actual water source. So that is especially risky in the informal settlements, especially where people may not even have tap water. So it becomes even more risky when you go to rural areas where many villages still access their water from natural sources.
And that is, of course, one of the big concerns there. And, you think about what is going on now. So, Minister, one of the things before we run out of time, of course, there's been this issue of misinformation. Some people putting information out there saying that there's an outbreak, but now you're contending with that as well. How difficult has it been? Well,
no, the outbreak is in terms of the public health definition. It doesn't mean when you say there's an outbreak, it's, in the sense that there is a water source contamination and it's a mass outbreak. But the fact that you have a laboratory confirmed, so in medical terms, you can still call it an outbreak because you have got more than 1 or 2 cases in a particular locality. But it's not, in terms of major public health threat, it is not. But it's just an alert which says that there are people in this particular area who have been confirmed, laboratory confirmed. So in medical terms, you can still call it an outbreak, but it's not a public health threat at this stage.
Before I let you go, let's talk about measles then. Where are we?
Well, again, in as far as measles, we still contained. It's been moving, starting with 2 provinces, spreading to up to, in the last count, there were new cases in the Western Cape. We haven't had any further confirmed new cases beyond the 6 provinces. The numbers are still quite low, and even in that case, I mean, because it's a preventable disease through immunization, even though we're still talking about just over 500 total over the last 3 months, in fact, more than from October last year, so just over 4 months with a total number of just over 500. It's not a massive, outbreak, but because it's a preventable disease, we still get consent, especially with measles, that, it's a disease which, spread amongst, especially, can be quite fatal amongst the children. So we're monitoring. It's also not at a rate at which we need to panic. But again, we call on all parents to make sure that children are vaccinated against measles, because we are quite confident that the chain can be broken with our mass vaccination programs.
All right, Minister, thank you so much for that update. We do appreciate it. That was the Health Minister, Dr. Joe Phaahla.